there, today I'm going to be explaining the differences between type 1 and type 2 diabetes. With type 1 diabetes, what you have is an insulin dependency. Your body is completely dependent on the insulin that we're receiving in our insulin pens because your pancreas cannot produce insulin. Insulin allows your body to help regulate your glucose blood sugar levels. Glucose is where we derive our energy. If you have low glucose, your body's going to feel
slow moving and you might feel tired and dizzy.
that would be called hypoglycemia. In order to be able to stabilize, we need the insulin in order to help us feel better, but as well as long-term use of lack of insulin or unstabilized insulin can lead to diabetic ketoacidosis. So if your body isn't getting insulin or energy from the glucose molecules in your blood, what happens is your body is going to get it from somewhere else, and your body's going to get it from your fat. With your body getting it from your fat, this can lead over time to severe dehydration. So it's very important that if you have an insulin dependency and your pancreas is unable to produce insulin on its own, you need to be dependent on the insulin that is given to you by your doctor. Second, type 2 diabetes. So they call this type 2 diabetes because there's two things to know. One is that you have an insulin deficiency, and two is that you have an insulin resistance. So with an insulin deficiency is that your pancreas actually does produce insulin, just not enough. So you need to supplement that deficiency by putting more insulin in your body. Secondly, you have an insulin resistance. So your pancreas is producing insulin, but your body just can't use it. So by taking oral medications or injections, you're allowing your body to make use of the insulin that is provided by your pancreas, and you will need medication for this. Type 2 diabetes is usually developed over time through age changes or obesity, and can lead to narrowing in the blood vessels that can cause poor circulation. And with poor circulation, you might also experience neuropathy, which is the loss of pain sensation in some of your limbs. And if you can't feel pain, then what happens is if your body has wounds or tearing, your body won't be able to feel that wound or that tearing, and that can lead to further infection without treatment. And that can lead to amputation. So the differences mainly, type 1 is an insulin dependency, it's an autoimmune disease, you're usually born with it, and type 2 is that there's two things to remember, insulin deficiency and insulin resistance, and those two things kind of develop over time and due to environmental or genetic, age-related, kind of a more complex look at developing it over time. If you have any questions about diabetes, please feel free to email me. I'm going to be here all day. Have a great day.